Mr. and Mrs. Lewis came to Africa for the first time, brought their kids on safari to northern Tanzania. On the second day, 7-year-old Amy got sick. Had a high fever, nausea, vomiting, and diarrhea. Mom freaked. She started insisting we medevac Amy home in the middle of the night at a cost of about $500,000 US. When she found out that wasn't an option, she started getting increasingly hysterical, screaming, "There's no place in Africa that can take care of Amy. There's no place here that can provide medical care like they do at home." My wife Susan and I were back in Tanzania after climbing Mount Kilimanjaro, where I almost died on top of the mountain due to high altitude pulmonary edema. Our plan was to build a hospital, but first we had a lot to learn about Tanzania and Tanzanian medicine. I thought a lot about what Mrs. Lewis had said, and I got to wondering, is it possible to build a medical facility in Africa that can provide as good a medical care as you can get in either the US or Europe? So I started talking to a lot of people, asking them what they didn't like about their medical care experiences. Interestingly enough, these complaints all tended to fall into one of 7 categories. Number 1, hospitals are dirty. Number 2, reception, they're mean and grouchy. Number 3, the labs are bad. No matter what my medical complaint is, they always tell me I have typhoid fever or malaria. Number 4, they treat us badly. This was primarily certain tribes and pregnant ladies. Number 5, the doctors never tell us what's going on. Number 6, not even sure the doctors know very much. They don't seem to understand what the problem is. And number 7, when they finally do come up with a diagnosis, send us for some medicine, it's always out of stock. So I got to looking at these 7 things and realized that almost all of them showed that these medical facilities didn't really care all that much about the patient. They seemed to only care what was good for them. So Susan and I realized that if we were going to be successful at all building a hospital, we would have to figure out how to deal with these 7 problems. I call these the Magnificent 7. Now, for those of you who have never seen either the original movie or the remake, it's basically 7 kind of bad guys. But if you can tame them and getting them all working together, they really can do a lot of good. So we came up with the motto, patient-centered care. This basically means that the patient's well-being is first and foremost. This has kind of become standard of care within the last 10 years in the US, but back then it was virtually unheard of. But what that meant for us was that everything we did, every decision we made, had to answer the question first, is this the best thing for the patient? Now, I know some of you are going, wow, that's way too many problems. You're never going to fix all those. But let me ask you, how do you eat an elephant? 1 bite at a time. Yes, exactly. 1 bite at a time. So here's how we tackled the Magnificent 7, 1 bite at a time. Number 1, hospitals are dirty. We put the word out in the community, sort of what our philosophy was, and we had people coming in to ask us for jobs. One of the first ones in was a woman who had really cool natural leadership abilities. We put her in charge of housekeeping. told her that her department was every bit as important as any other hospital job, any other department. And she took that challenge, especially after we told her that every single patient that came into Fame Medical Health Center, their first impression was going to be dependent on how she and her team did. Ever since we told her that, the place has absolutely sparkled. Number 2, reception. They're mean and grouchy. Well, when it came time for us to hire reception people, we chose not to go to the mean and grouchy reception store. We went to the hospitality. Now, most of you probably know that in this part of Tanzania, there are literally thousands of people who have gone to school, been trained, spent their whole lives perfecting the art of making sure that people are taken care of and make them feel special. Once we put them in reception, everything changed. People lightened up, they were smiling, everybody was happy. Number 3, the lab. They're always bad. They always say we have typhoid fever and malaria. So what we did, we brought in a retired PhD microbiologist and lab technology professor. We teamed her up with a very sharp lab manager from Tanzania, and they went to work transforming the lab. Before we started training the lab, our positive rates for typhoid fever and malaria ran about 30%. After they got done training our lab techs, that fell down to 1%. So it was a pretty amazing transformation. Number 4, they treat us mean. Number 5, doctors never explain what's going on. I kind of clumped these two together because the solution was pretty much the same thing. We got all of our staff together, big groups, little groups, one at a time, and we had them do this exercise. We told them, close your eyes. Imagine your little 84-year-old mother has been very sick. She's been to multiple doctors, multiple hospitals. Nobody can figure out what's wrong. So she has just traveled 6 hours because she heard Fame is different, that you can figure out what's wrong. So you're not going to be mean. You're not going to be gruff. You're not going to go, what's the problem? This is your mother. You're going to schmooze her a little bit. You're going to talk nice to her, make her feel special. Then you're going to make her feel even more special by asking her a lot of questions about what her complaint is. And then you'll make her feel really, really special by actually doing a physical exam. Then when it comes time for you to go to the lab, you're not going to just check every box on the lab request form because that's going to cost a lot of money. And this is your poor little mother. So you carefully decide which are absolutely necessary. Send her off to the lab. When the lab results come back, you look at them, not really sure what's going on with mom. What you do not do is give her a bottle of cough syrup and a few ibuprofen and send her off. What you do is you go around to some of your colleagues for help. Say, guys, got any idea what's going on here? You look things up on the internet. You get a textbook. You keep searching until you figure out what's going on with mom. And then you don't just throw a prescription at her and say, go to the cashier. You explain what she has, what the medicine is supposed to do, and then you ask her, does she have any questions? By the time mom leaves your office, she's smiling and feels really well taken care of. Then we tell our staff, every single patient that comes to Fame Medical, you treat exactly as if it was your mother. Everybody. Doesn't matter what tribe they are. It doesn't matter if they're from way out in the bush and may not smell real good. You treat them exactly like you would your mother. Number 6, The doctors don't know what's going on. This is pretty complex. When I first got here to East Africa, I realized that in rural Africa, doctors are expected to know everything. Back in the US, almost everybody is a specialist. So if you want to go to the doctor, they'll go, "I'm sorry, I just treat diaper rashes on kids under 2. But here it's very different. Doctors are expected to know anything and everything that comes in. So this is an almost impossible challenge. What we did to make it easier for our doctors, we started on a real rigorous campaign of continuing medical education. 1 or 2 mornings a week, we have lectures, starting with the common things, coughs, colds, sniffles, working all the way through to the more complex things like diabetic ketoacidosis and the complications of thyroid dysfunction. So they basically get taught virtually everything that they will come in contact with. And then remember those cool old people? We bring them back. We bring volunteers in to work with our doctors, to give lectures. These volunteers have wonderful stores of knowledge, wisdom, experience, and they love to share it. And if they're old enough, they even have the time to do it. It's kind of a two-way street, though. It's not just them teaching us. Our doctors teach these Western doctors what it's like to be a doctor practicing medicine in rural Tanzania. And that's a real eye-opener for them. It's been a very good two-way street, learning both directions. Number 7, no matter what medicine they say I need, it's out of stock. So once again, I sat down with the head pharmacist and I said, "Look, your mother's just been admitted to the ward. She has a serious infection. It's going to require a special medicine. Are you going to tell her it's out of stock?" "Of course not. That's your mom." When you hear the words out of stock, that just means you start looking. You call other suppliers. You call other pharmacies. You call other hospitals. You keep working until you find what she needs. Now, since we did that, we almost never come across the situation where we're told we don't have a medicine. They have managed to supply us medicines, what we need, almost all of the time. So what has been the result of this little 10-year experiment we did up there at FAME? To be honest, it's actually succeeded far beyond our wildest dreams. We're having patients coming from further and further away. Our patient load just grows every week as people hear about what we're able to do there. And I think what's been even more interesting is the reaction we get from tourists. They have amazing stories over and over again about this being the cleanest hospital they've ever been at, this being the best staff. Everybody has a great attitude. It's maybe the best nursing care they've ever seen, and they say over and over again, this is better than any medical care I can get at home. Now, let me give you a couple of specific examples. I met this 79-year-old woman who'd just come out of the doctor's office, and she had tears in her eyes. She said, "Never in my entire life has anybody made me feel so special and so taken care of. It's never happened to me before." I went out to the courtyard where I saw one of the Maasai chiefs from the Ngorongoro crater. And we were sitting there looking at about 60 Maasai milling around in their red shukas. And I said, "Mzee, how can you explain all these Maasai coming here for medical care?" Without hesitating a minute, he said, "That's easy, because you treat every Maasai exactly like you treat your rich white tourists." So this has all been a very satisfying result for our experiment. But the interesting thing is, it's all replicable. All of this can be done, and it doesn't cost a single shilling more. We've discovered that you can practice very good medicine without spending any more money than practicing bad medicine. What we do when we interview people that are interested in working with us, they have to be willing to be lifelong learners, to do things a little bit different, and to embrace our philosophy of patient-centered care. So when people ask me, do you think African medical care can ever be as good as it is in the US or Europe? I say absolutely. Not only as good, but oftentimes better. I think it's time that we change the narrative around medical care here in East Africa. Embrace the patient-centered care model, tackle the Magnificent Seven, and just start taking one bite at a time. Thank you.